Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on the topic of pathology for diabetes. So what exactly happens in the body of a diabetic patient? It is very important for a diabetic patient to know what exactly happening in his body. So we will discuss in depth what is causing diabetes, what is the mechanism that is underlying it. So can we encounter it because with this knowledge, okay, that is very important to us. Basically what happens is obesity is the main reason for diabetes. What happens in obesity is, so there will be two types of fat deposited. It means the fat is deposited at two places. One, we call it a subcutaneous fat that is deposited below your skin. There is one more fat that is deposited in your belly. We call it as visceral fat. Both visceral fat and subcutaneous fat are coming up from your diet. So if you take more carbohydrate food or more fatty food, it will go and deposit in your skin or in your belly. So we call it as visceral fat and also subcutaneous fat. What happens here is, the first mechanism that is going to hamper is insulin resistance. You will get resistance for insulin will convert glucose that is entered in your blood to glycogen and stores it, and also it will convert fatty acids into triglycerides and stores it, and it will synthesis proteins from amino acids and stores in your body cells. So what happens in insulin resistance is, these fat tissues, mainly the visceral fat, will release some inflammatory mediators. These inflammatory mediators will hamper the mechanism with which glucose uptake or amino acid uptake or fatty acids uptake into the cell. So this is impaired. When this is impaired, the blood contains more amount of glucose, it will not go into the cell. More amount of amino acids, they will not go into the cell. More amount of fatty acids, they will not go into cell. Basically this glucose, it pile ups in the plasma, it will not go into the cell because these inflammatory mediators that is released from visceral fat hamper the mechanism so that glucose is converted into glycogen. This is the first thing. What here happens is, in order to, this is the insulin resistance. So because of insulin resistance, glucose in the body will be increased on with the positive negative feedback mechanism. The body thinks that there is no energy for it, and it will further increase the uh, insulin secretion. Insulin is already there, but it will further increase, thinking that there is no insulin and there is no glucose coming into the cells. That's the reason it gives the negative feedback and further insulin increase. So we landed here into two things. One is hyperinsulinemia, where there is excess of insulin in the body, it is almost 2 to 3 folds, and hyperglycemia, excess of unused glucose in the plasma. This we call as insulin resistance. The next mechanism is, there will be decreased production of insulin. We will check why the decreased production of insulin is happening, or why insulin is not produced. What happens here is, the pancreas is under stress. Even though it is releasing the insulin, the glucose is not going into the cells. What it does is, it releases more insulin, and it becomes more stressful for the pancreas, especially the beta cells that are going to release the insulin is under stress. This we call as oxidative stress. Because of oxidative stress, the mitochondria and endoplasmic reticulum within the beta cells is destroyed. So when it is destroyed, the insulin production is also destroyed. So there will be apoptosis. Apoptosis means cell death, death of the beta cell. Once there is death of the beta cells, the mass of the beta cells is decreased, and also function of the beta cells is decreased. So insulin production is finally decreased. This way, at the end, there will be hypoinsulinemia, where there is a very low secretion of insulin by beta cells, and hyperglycemia, high amount of glucose in the blood. So because of these two things, what is happening is, this is the mechanism of glucose, the pathogenesis of diabetes. This whole cascade will take at least 10 to 15 years. It will take 10 to 15 years for the body to land into this state. So within 10 to 15 years of after your obesity or abnormal food habits, you will be landing into diabetes. Once we land into diabetes, there will be elevated levels of glucose in the body and elevated levels of insulin in the body. These glucose and insulin, they produce inflammation everywhere in the body.